Corruption Watch says it's received reports of alleged corruption within the health sector for a number of years now. Let's discuss this further. We're joined by Mzwandile Banjathwa, who is Corruption Watch's campaign coordinator. Good evening, Mzwandile, and thanks for your time. Now, you've been tallying some of the reports that you've been receiving over the years, especially in the health sector, and those seem to be particularly alarming.
They are quite alarming. I mean, since 2012, we have received over 28,000 reports of alleged corruption. About close to 700 rather of those reports are pertaining to the health sector specifically. So of those reports, about 52% of them are pointing a finger at provincial government, whilst the 40% is pointing a finger at provincial government. And we are finding that Gauteng is leading in the number of reports that we are receiving. About 39% of our reports come from Gauteng. The 16% come from KZN, and the Eastern Cape and Mpumalanga are tied at 8%. So where we get the least number of reports tends to be in the Northern Cape. So the prevalent types or other forms of corruptions that tend to come up would be the employment corruption at 39%. There would be procurement corruption at 22%, and misappropriation of resources at 16%. So these would also vary from province to province. I mean, like I said initially, that in the Northern Cape, for instance, we get the least number of reports, but in those number of reports that we've received, about 55% of those reports are actually employment corruption, whilst in Limpopo, for instance, we're getting a lot of procurement corruption. About 50% of those reports are procurement related. And in the Eastern Cape, we're finding that the number of reports that we are getting particularly pertains to misappropriation of resources.
When it comes to employment corruption, what exactly are people complaining about? What are they saying is happening within the employment systems of the health department?
So they tend to speak about a variety of issues, firstly pertaining to absenteeism, to allegations of nepotism and favoritism as well. So with regards to nepotistic appointments and decision which are assumed to be made based on favoritism, the trend seems to suggest that those who are, or rather who have the authority to design the criteria for vacant posts are the ones who are actually appointing people who are closest to them. So we find that there are unilateral decisions that are being implemented when there needs to be engagement. So for example, when there needs to be a panel that has been set up, you find that there's this one dominant voice which seems to sway the entire panel into appointing a candidate at times which is not fitting the criteria or has the least qualifications. So we're also finding as well that there are instances of bribes that are paid as well. So there is also no accountability when we start posing some of these questions to the department.
When you are in contact, especially with those that are registering some of these concerns, how willing are they to give you as much details as possible so that it goes beyond just being a claim that's being lodged with Corruption Watch, but that you are actually empowered to do more with it and ensure that if there has been an appointment made due to bribes being paid, that decision can be reversed, because surely that person would not necessarily have been in that post without the money that they paid, especially if they're not qualified for the position.
Yeah. So in a country like ours, where people are afraid of reporting corruption, the 700 cases of corruption that we have received from the health sector specifically is very much important and should be treated as important as it is. But what we are finding is that the majority of people who come to us have a variety of options. They can either report to us anonymously, and that tends to give them the courage to come forward, the anonymity of it. So once they have reported to us, we then take it through our internal processes. So that tends to help us in either increasing the reports that we are receiving. But we do as well interact and engage with various stakeholders. So as we speak right now, we are, as Corruption Watch, are part of the National Anti-Corruption Health Forum, which comprises of a variety of stakeholders from various civil society organizations to government entities as well, and law enforcement agencies as well. So this is led by the SIU. As we speak right now, there are various cases which we have sent to them, and they have already been proclaimed in a part of investigations.